Welcome back. I'm Dr. Cheek and I'm a licensed clinical psychologist. And today we're going to talk a little bit about medication or mental health medications and the side effects to some of those medications, or some of the most common side effects to those medications. And I'm going to talk about those different side effects and maybe some of the things you should do if you start to notice those different side effects, and some questions to ask your physicians before being prescribed certain medications. And when I talk about mental health medications, what I'm talking about are things such as antidepressants, anti-anxiety medications, benzodiazepines, antipsychotics, mood stabilizers, or any other psychotropic medication that is prescribed for mental health concerns. And I want to talk a little bit about the common side effects, because sometimes we don't pay a lot of attention to the things that happen to us when we introduce new medications into our systems. And these are things that we should probably be aware of. And I'm going to break them down into 3 different categories. The 3 categories are mental, physical, and sexual side effects, because those seem to be the most common side effects that occur as it relates to taking mental health medications. First, let's focus on the mental side effects. So some of the mental side effects are some of the things you may experience to certain mental health medications that are things such as feeling some level of confusion, having an inability to focus or concentrate, having concerns with memory deficits or changes in your memory function, having increased anxiety in the form of racing thoughts. It could be some level of fogginess or confusion or dizziness. And also there could be the possibility of an increased risk of suicidality. And this is typically common in children, adolescents, and young adults, but it can occur with any individual taking the medication. So if you start to notice that suicidal thoughts are more pervasive, be willing to have that conversation. So these are some of the mental side effects that you may experience. Now, there are some physical side effects as well. Some of those physical side effects are things such as headaches, racing heart rate, weight gain or weight loss, changes in appetite. So whether you have an increased appetite or a lowered appetite, there may be some GI concerns or gastrointestinal concerns such as nausea or diarrhea or constipation. There may be concerns with dry mouth or difficulties as it relates to sleep. So there may be some sleep problems in the form of insomnia. And then there may also be some concerns with like tremors or shakes. And the one thing that I'm pretty sure that most of us are aware of and we've seen commercials for, which is commonly the uncontrollable body movements associated with TD or tardive dyskinesia. And that is a side effect of certain antipsychotics or certain other mental health medications. So being aware of what those look like or what the possibilities are physically is also helpful. Now, lastly, I want to focus on sexual side effects as it relates to taking mental health medication. Now, the common sexual side effects are erectile dysfunction. So erectile dysfunction in the form of either not being able to achieve an erection or having an inability to maintain an erection. There may also be concerns with a lowered libido or a lower sex drive. There may also be a concern with delayed orgasm or an inability to orgasm. So these are some of the most common sexual side effects that tend to occur as it relates to taking mental health medication. And there is another common side effect that I do hear a lot from clients taking mental health medication, and that particular side effect is numbing. It's an emotional side effect. So you feel numb or you feel disconnected from your emotional state. And what that tends to look like is that you feel emotionally flat or having no affect, or knowing that a situation calls for an emotion and having the desire to feel those emotions, but not being able to express those emotions, and that is actually necessary with this particular situation. So that numbing or that emotional disconnection is a side effect. And what we should do if we're having any of these side effects is talk to your prescribing physician. And the reason why I say prescribing physician is because some people get the medications from their primary care physician, some individuals get medications from psychiatrists, and some people see other medical doctors for these prescriptions. So depending on who you receive the prescription from, it is best to actually have that conversation with them and let them know the side effects that you are experiencing. And when you are letting them know the side effects you're experiencing, try to be as concrete in what you're experiencing as possible. Some individuals tend to make statements such as, I just feel weird, or the medication has me feeling off. And that's not a clear indication of what's actually happening. Now, there is no expectation that you will know what the side effects are, although you can with any medication you're prescribed. More than likely you'll get a 400-page worksheet of what the medication is made of and the side effects. And I know we all read those. So since we don't all read those, it's it's better for you to, if you're not aware of what those side effects truly are, when you're trying to let your physician know what's actually happened for you, simply describe what is happening for you in detail. Because if you're able to describe it, chances are the prescribing physician has an understanding or has some level of understanding of what that side effect description may be connected to. So being able to at least describe what you're feeling in actual details of more than saying, I just feel weird, more along the lines of, now I'm starting to feel nauseous on a daily basis. Every time I eat something, I feel like I want to throw up. Even if I don't eat something, I feel like I want to throw up. Or I used to be more sexually active. Now I don't even think about sex anymore. The thought of actually engaging in sexual activity doesn't even cross my mind anymore. Or I'm starting to feel my heart race. I'm feeling overly anxious or panicky whenever I take the medication. Even that is a description that may be helpful. And then that gives an idea of what's actually happening and what's the side effects and what medications could be contributing to those side effects. The expectation is that you would know how you're feeling different. So be willing to at least describe what those symptoms look like and avoid being vague as much as you possibly can. Now, there are some other things that you may need to be aware of when it comes to medications, side effects, and being prescribed psychotropic medications. One of the things you may want to be aware of is there are side effects that could be induced by the interaction between certain medications. It can be interactions between the mental health medication and maybe a medication you're taking for physical health, like blood pressure medication or diabetic medication or other types of medications such as medications for headache or medication for pain. They can have an interaction or they can have some type of interaction with mental health medication. So you need to be aware of or notify your prescribing physician of other medications and supplements and vitamins you are taking, because they could have an interaction that causes some of those side effects I mentioned or may cause some other severe side effects. So being able to be aware of that and knowing that is actually helpful. And also with mental health medications, there are certain medications depending on dosage and types of medications and other factors that two mental health medications can cause a rare interaction. And if that rare interaction happens because of two medications you're taking, be willing to have that conversation as well. You may not know what that interaction is, but what you may be aware of is when I started to take these two medications together, I started to experience this symptom and this symptom and this symptom. These are the things that started to happen when I started to try this new medication with my old medication, or when I started to take these two medications together. Be aware of that. And some things I want you to keep in mind. Mental health medications are, unfortunately, is a lot of trial and error with finding the appropriate dosage, with finding the appropriate medication regimen. And I know that's not fun. That's probably the worst part of starting new mental health medication, is going through the trial of seeing if it works or knowing what these side effects will be and experiencing these side effects. But with most things, our bodies and our minds react differently to medications. We all react differently to medications. And the example I tend to give for this is that I can take an 800 milligram ibuprofen, and if I take an 800 milligram ibuprofen, I am going to go to sleep. I am definitely going to go to sleep and I cannot function throughout the day. But there are a lot of people out here that deal with chronic pain on a daily basis that can pop an 800 milligram and continue to go about their day and never get drowsy. And that's drowsiness is another side effect that I missed earlier. But the way our body metabolizes and interacts or reacts to medication is different. So know that a physician may not always know how you're going to react to certain medications. So this is what that trial period is for. Be willing to have a conversation about what you're experiencing during those times. Now, some questions you may want to ask to your physician when you're being prescribed new mental health medications or new psychotropics are questions such as, what side effects are common with this medication? Again, we know you get the 400 pages with the medication, but sometimes it's helpful to have that conversation with your physician to find out which ones are common, which ones are rare, and which ones you should be truly concerned about if they do start to appear. You can also talk to the pharmacist about this as well. Also, another question you may want to ask is, are there any interactions with this medication that you're prescribing and the medications that I'm already taking or the supplements I'm already already taking. There could be over-the-counter supplements. There could be vitamins that you're getting that also interact with these medications as well. And another question you may want to ask is, are there alternatives to this medication that has a side effect that you may be concerned about, or a side effect that you may notice once you start taking it? Are there alternatives, or are there dosage recommendations that could also be helpful that may not cause the same level of side effects? And lastly, what you may want to ask is, how long do these side effects last? Because medication side effects are not always indefinite. There are some side effects that you may experience with these medications that will last for a few weeks and then start to subside or start to decrease, and you may start to notice them go away. So having that conversation with the physician to say, what side effects should I expect, or what side effects are common, and are these side effects that normally subside, and how long should I wait before I actually reach out to have concerns, are great questions to ask. And to go back to the other discussion about the emotional numbing that you sometimes feel with medication, that emotional numbing is something that should be addressed. If you are experiencing that as a side effect, please be willing to speak with your physician about that, because the goal for mental health medication is not for you to completely numb out your emotions. It's not for you not to have emotions. It's not for you to stunt your emotions in any way. The goal for mental health medications is to manage those uncontrollable emotional reactions or responses when you don't have the ability to do it behaviorally. The medication is meant to maybe stabilize those emotions so you're able to engage in a more healthy way. It's not to numb or disconnect those emotions. So if you're feeling numb emotionally, or if you're feeling disconnected from your emotional experience, have that conversation with your prescribing physician, because 9 times out of 10, what they'll need to do is either lower the dose or change the medication. Either way, have this conversation, have a really candid conversation, even about the sexual dysfunction. So, what I hope you take from today's conversation is this. Mental health medications, psychotropic medications, just like any other medications, has some common side effects. They have common side effects that may subside after taking the medication after a certain period of time. They have some side effects that won't subside that may require changes in the medication, whether it's the dosage or the medication itself. There are also some side effects that are truly severe that requires a complete change in the medication regimen as soon as possible. Either of those are things for you to be aware of, be willing to speak with your prescribing physician about, be willing to give concrete, not vague descriptions of what you're feeling as it relates to taking these new medications. And just as a note that may be helpful is when you start to take new medications, start to notice each day, track each day, anything that you're feeling that you were not feeling prior to starting this new medication. If you need to write it down, write it down. Sometimes we're our own worst historians. We feel like we can remember everything until we have to remember it, and then it's not there. So be willing to maybe write some of those things down, but track how those medications may be changing you mentally, physically, or sexually, and know what those side effects are, and have that conversation with your physician either prior to being prescribed that medication or after you start to notice those side effects. Whichever you feel more comfortable with, have that conversation so you can make sure that the medications you're taking are something that's being more helpful for you than not, and does not set you back on your mental health journey. Again, we don't want to numb emotions. We want you to have those emotions. We want you to be able to feel those emotions. So if that is happening, have the conversation. Be willing to be clear about what your medication needs are, and if there are some changes that has happened since introducing this new medication to your body that can affect not only the way your brain is functioning, sometimes the way your gut is functioning, sometimes the way other organs in your body is functioning. So be aware of that. Have that conversation with your physician. As always, I hope you've learned something and take something useful from today's video. Please jot down any thoughts, questions, or comments you have below. I thank you for taking the time to listen, and I'll be seeing you again very soon. Thank you.